Well, reports of new COVID-19 cases in Hampton Roads are largely trending down. Now, many who got sick with Omicron are grappling with what comes next after infection and their isolation period. Angelique Arentock spoke with a doctor and shares his advice.
UVA Assistant Professor of Infectious Diseases Dr. Patrick Jackson aligns his isolation period guidelines with the CDC. He recommends people with COVID-19 stay home for at least 5 days after onset of symptoms or after their positive test. At day 5, he says that if you're feeling okay, definitely wear a mask should you need to go out for the next 5 days. Jackson also cautions avoiding people who may be vulnerable to the virus during that 10-day period.
While natural infection does confer some immunity, and that is important, it's still the case that vaccination and vaccination plus boosters give you even better immunity.
And he tells me you don't have to wait too long after you've recovered.
You can get vaccinated or boosted as soon as you're out of that isolation period. So for most folks, that's outside of 10 days after the onset of symptoms, as long as you're feeling better. For patients who are immune compromised or have severe disease that made them end up in the hospital, that can be up to 20 days.
Jackson also points out that while there are early signs of Omicron receding, hospital systems like at UVA are still bearing the burden of this surge. Couple that with uncertainty over what's next in the pandemic, he says it's still worth it to follow public safety precautions like mask wearing and distancing even after getting over the virus.
There's no reason to run additional risks.
Jackson adds that reinfection of the same strain is uncommon, but he says it can happen. In Norfolk, Angelique Arentock, 13 News Now.
And Dr. Jackson also said people at highest risk for reinfection are the immunocompromised or those who previously had a mild case of COVID. You heard the doctor mention the importance of vaccinations. Well, here's where vaccination rates stand in the United States. As of earlier this week, a few states, including Virginia, had more than 70% of the population fully vaccinated. The majority of the states are somewhere between 54 and 70%. North Carolina falls into that range. A few states still have less than 54% of their populations fully protected.